Dear all, thanks for your interest in my presentation. I'm Bich from the Bureau of Health Information of BHI, and today I'm going to present our work on the experience of care of Aboriginal patients in New South Wales public hospitals. A brief introduction about BHI. We are an independent organization provides trusted information to help inform decision making and improve healthcare delivery in New South Wales, Australia. For international college, New South Wales is the most popular state in Australia, where houses the largest population of Aboriginal and Torres Strait Islander Australians. New South Wales has a publicly funded healthcare system with more than 200 hospitals and clinics. Each year, there was more than 2.5 million visits to EDs and 1.9 million admissions to public hospitals. BHI has developed a methodology for analyzing trends over time in patient experience, which were recently published in our Healthcare in Focus report. This report shows the trends of patient experience for those admitted to hospitals or visit hospital EDs from 2014 to 18. Asking Aboriginal patients about their experience of healthcare is a priority for the BHI. BHI has also partnered with the New South Wales Centre for Aboriginal Health, and we have produced a number of reports on Aboriginal patient experience, which provide information about what services are doing well and where they can improve. This presentation brings together BHI's work to better understand Aboriginal patient experience of care. This analysis was to investigate the trends of patient experience over 5 years from 2014 to 18 in Aboriginal and non-Aboriginal patients who were admitted to public hospital in New South Wales. We analyzed 51 measures of patient experience that has been asked every year in the period. The questionnaire was sent to the patient within 3 months of the discharge. For each question, response options were grouped into the predefined most positive response, and multivariable logistic regression was used to explore the trend effect over time, adjusting for age, sex, language spoken at home, and education. Overall, the response rate among Aboriginal and non-Aboriginal populations was 18% and 37% respectively. The response rate for Aboriginal patients was lower than the non-Aboriginal patients across the period. There was more than 120,000 patients respond to the survey in the past 5 years, and the proportion of Aboriginal patients was about 4% in average. The high proportion of Aboriginal patients in 2014 was because BHI did the oversampling of Aboriginal patients in this survey year. Descriptive analysis showed that Aboriginal patients were significantly different from non-Aboriginal patients in terms of age, sex, education, and language spoken at home. Aboriginal patients tend to be younger, and being a female, there was a high proportion of Aboriginal patients had education less than year 12. And a greater proportion of non-Aboriginal patients spoke other language than English at home. Overall ratings of care is one of the most important measures over the 5-year period, although there was no significant improvement for either Aboriginal or non-Aboriginal patients. Aboriginal patients in recent years has less positive experience than their non-Aboriginal counterparts. Another measures of cultural beliefs reveal that the experience is lower in Aboriginal patients than in non-Aboriginal patients. In summary, among 51 performance measures took into the consideration, only 4 measures were significantly improved over time in Aboriginal patients, whilst there were 37 measures improved in non-Aboriginal patients. There was no measures that was significantly declined in Aboriginal patients, and 1 measure declines in non-Aboriginal patients. That was about the delay in discharge. The measures improved in Aboriginal patients was the questions about privacy, waiting time between appointment with specialists and hospital admission, communication with health professionals about the surgeries, and the communication with the nurse. In summary, Aboriginal patient experience of hospital care was less positive than non-Aboriginal patients. Experience of care improved on fewer measures for Aboriginal patients than for non-Aboriginal patients. There is still room to make improvement in the delivery of healthcare services, especially for the Aboriginal patients. More information on our report and patient experience could be found on our website or in the interactive portal Healthcare Observer. Thanks for listening.